Welcome back. If the unthinkable happens and you're involved in a traumatic accident or an act of violence, your best hope to keep your life is a trauma center. And here to tell us about the incredible Level 1 program right here in Tucson is Dr. Randall Friese, trauma surgeon at Banner University Medical Center. Doctor, thanks so much for being here.
Sure, Alex. My pleasure.
Nice to see you. So let's start by defining that Level 1 designation of the trauma center. What does that mean?
Sure. Level 1 designation comes from either the state in the certification way, or from the national body which verifies the certification, and that national body is the American College of Surgeons. So a state Level 1 provides 24-hour operating room availability, 24-hour anesthesia, 24-hour surgery, general surgery, trauma surgery, and then you have your specialists are available on call to come in if needed. So those 24 hours are in-house. And the specialists, the neurosurgeons, the orthopedic surgeons, the plastic surgeons are available to come in at any notice in the middle of the night if needed. And that means you're a state certified Level 1. A state verified Level 1 has all of that, plus does research on top to advance the care of the injured patient, to study different things, to look at patterns, to make sure that we're doing the best we can for our injured patients.
In other words, you're equipped to handle anything at any time.
That's exactly right.
And how does that compare to a Level 2 trauma center?
So a Level 2 trauma center is sort of again, if you're talking about a state certified Level 2 trauma center, they have less resources immediately available. They may or may not have a general surgeon in the hospital. But now if you're talking about a Level 2 verified, they have everything. That's the national verified. They have everything that a Level 1 does. They just don't do the research.
Right.
That's not required of a Level 2 verified center.
Okay. And is this the only one in Southern Arizona, Level 1?
Right. Right now, Banner University Medical Center is the only Level 1 state certified and Level 1 nationally verified trauma center. So we're taking care of people and doing research, trying to advance the art of taking care of the injured patient.
And so, I mean, I kind of hit on it that you're equipped for anything at any time, but what does this mean for patients who are involved in traumas? We're seeing an example of somebody walking to an emergency room.
Sure. So the trauma center is not just the hospital. There's also the pre-hospital. The trauma is a team sport. Taking care of the injured patient involves many people. The physicians, bedside care providers, nurses, emergency room physicians, surgeons, specialty surgeons, and the field personnel, the paramedics, the EMTs, the flight helicopters, the transports in. So it's a really large group of people taking care of the injured patient. So you may be one injured patient, and you may have 10 or 15 people involved in your care initially as that plan of care is worked out.
Wow, what an operation. And of course for pediatric care, this means a lot too, right?
Yes, at Banner University Medical Center, we've been the only pediatric trauma hospital for many years, but just recently received our Level 2 certification in pediatric trauma, meaning we provide 24 hours a day trauma care with a subspecialist and ability to go to the operating room at any time, but we don't do as much research in the pediatric trauma patient as we do in the adult setting. Okay,
and then as far as burn victims, for example, what does that mean for them?
So having a burn hospital, at least a burn program in Tucson is a very important thing. Years ago, when I first came here in 2008, a lot of our burns would go from the field straight to Maricopa, which is the burn center for the state. We were able to we were comfortable enough to say, bring them to the university hospital first. Then we'll make a determination of who do you think we can treat here versus who needs to go on to the full burn center. You know, we've been able to decrease the number of people going to Phoenix, and I think that's really good for the families of patients. Patients that can be managed here, their family can be nearby, they can be at the hospital with them, you know, while they're having their procedures and their burns treated operatively. You know, and then of course the outpatient rehab, that's part of the whole process, is an important arm as well.
Just incredible how complex all of this is. And you know, we're going into the holidays. People might ask you, as a trauma surgeon, how do we stay safe throughout the holidays? You had kind of a funny answer, which I think is probably some good advice.
Well, I think, you know, one of the first things that comes to mind is stay at home, enjoy the holidays at home with your family. But if you have to go out, be responsible and think about what you're doing. Of course, don't drink and drive. Wear your seatbelt. If you're riding a motorcycle, wear your protective gear, including your helmet, and always have a plan B so you can get home safe.
Right. No nonsense advice there from Dr. Friese. Of course, you guys are there if we ever need you, and it's nice to have that peace of mind right here in Tucson. It really helps raise our profile. I mean, Tucson's already so great, but to have this Level 1 designation and have that right here in our own backyard is a very big deal. So
Yes, and it's a commitment to the community.
Right.
The hospital provides, that their trauma team is providing.
Commitment
Absolutely.
to the community. Dr. Friese, thanks for your time this
My
morning.
pleasure. Thanks for the invitation.
Nice to see you. Now, for more information about Banner University Medicine, log on to bannerhealth.com.